supplements. For heaven's sake, do not buy any food supplements for arthritis. Millions are available across the counter. Nowadays, we have what is called this web shopping. I do not know. I don't know how to shop on the web. But so many, yeah, it will be delivered. I don't want to mention any names. It will be delivered by this person, that person, this person. And this is about only $2. It will make your arthritis fine and you will run like a kangaroo, or you will rather you will just gallop like a stallion or something like that. It's nothing like that. There is no specific food supplements in arthritis. I may be totally irrational in what I talk, because nowadays what happens is when people come to us for a suggestion, they want you to tell them what they have already thought. That's very difficult. If I am a truthful man, I will tell that what they're thinking is wrong. We are not here to oblige people with what they want. Because I am the doctor and we know what it is. It is not out of ego, it is humility, and it is out of empathy. We don't want to do anything wrong to you. Simply don't go and buy in the pharmacies and order online all you call this food supplements for arthritis and take. Just go to the vegetable market and the fruit market, buy plenty of green leafy vegetables, take plenty of fruits, fresh fruits you can take. You can take dairy products like milk. You can take some even yogurt or something like that and be fine. Now some people will come and tell me, doctor, when I take certain foods, my joint pain increases. There is a lot of fight between foods and arthritis with respect to food allergy causing arthritis. It is not very clearly proved. But if you feel some particular food is causing aggravation of your arthritis, we doctors will give benefit of doubt to you and say, avoid those foods, that's all. But you can eat whatever you want. The other important point is that patients with arthritis, especially like rheumatoid arthritis, ankylosing spondylitis, they feel they should never get married. Why you should not get married? You should also get married and suffer, I say, when we are all suffering. So all arthritic patients should get married and go through the suffering of marital life. There's nothing wrong. Arthritic patients can marry. But important point is, it is better to disclose to your counterpart that you have an arthritis, you require lifelong treatment, and definitely people agree and get married. I have so many patients of mine, both males and females, who have rheumatoid arthritis, who have ankylosing spondylitis, who have got married, who raised their family, and even their children have got married and they develop even daughters. So arthritic patients can marry. Can an arthritic patient become pregnant? With this, they should not become pregnant. I'm sorry, I fight with them. Arthritic patients can marry and get a child. There's no problem at all. But only thing is, certain medications when are given like methotrexate to a patient, that time they should not become pregnant. You can discuss with the doctor when the disease becomes inactive, when I'm fit for pregnancy, for conception, and which drugs I should not take during pregnancy. All these things the doctor will clearly write it and give. And I have seen thousands of patients with arthritis, maybe rheumatoid arthritis, maybe systemic lupus, maybe ankylosing spondylitis, getting married and also having children. So don't get worried about it. See, one thing is very important. If I have arthritis, I have severe pain. Sometimes my joints will get deformed. I'm physically dependent on people, even to wear my clothing or have my bath or even cut vegetables. I request the family members to kindly be empathetic to them. Please be empathetic to them. If they complain of pain, if they are not able to do, the family members should rise to the occasion. The wife has got, the husband should come up. The children should get up. If the husband has got, the wife, the children, etc. should come up. Very, very important. Anybody can develop disease at any point of time. Even the husband or the wife can develop arthritis after she gets married. So please be empathetic to people. Just don't shout at them and say, no, you're always complaining of pain, I'm getting irritated with you. That's not right. If you get the same problem, what will you do? You know what God said? You should treat others like how you expect others to treat you. That's very, very important. If you only think of this statement, no, I will treat Ramakrishnan will treat another person in a way in which the other person needs to treat me. That's very, very important. Treat them like human beings. They also have feelings because they get depressed and a lot of psychosocial problems also come into problems. Then people will come and say, Doctor, I got rheumatoid arthritis. Is it hereditary? Will my children develop it? Very minority. Don't get worried about it. People will say, is there any vaccine for arthritis? Vaccine for arthritis is not on the cards. Still for COVID and even HIV infection, we have not developed. Tuberculosis has been there for centuries, even that they have not found a vaccine. So still we know vaccination for arthritis is available in the world. The last one is, any need for lifestyle modification in patients with arthritis? Yes, you should modify their life. First, dietary modification, very important. Exercise modification. Good hygiene with respect to sleep, at least sleep 6 to 7 hours. That's very, very important. Arthritic patients like ankylosing spondylitis should not use a pillow, or they can use a very thin pillow. It is better to always lie on your chest or on your back. If you lie on your sides, you can keep a small pillow between your thighs. But if you're lying down flat on your back, don't keep pillows under your knees. That's very, very important. The knee joints can get bent like that. It can get bent like it, and ultimately you have to undergo surgery. Early morning, when you get up, you can buy a bowl of hot water, put a pinch of salt, and do these exercises. Have a warm water bath, and very, very important, a well-balanced diet to maintain a normal weight. What is called the normal BMI should be done. The last thing, I know everything about arthritis because the internet taught me. Sorry, 37 years I've been a rheumatologist. 5 years I did MBBS. Doesn't mean I failed every year. 5 years is the duration course. 1 year house surgery, that is 6 years. 2 years MD, that is 8 years. Then I come down to DM rheumatology, DM, that is 2 years. 10 years and 37 years, I do not know much in rheumatology. So don't think you know everything. Please listen to all of us, and don't have unnecessary myths in arthritis at all. I tell you the last important thing, life is mobility and mobility is life. So take care of your joints. If you have any problems, you can always email to us. Due to osteoarthritis, left knee gives a feeling of heaviness. Daily exercise and avoiding of squatting and climbing stairs. What is the remedy? Very good. I didn't discuss about osteoarthritis. Basically, if you take osteoarthritis, it is occurring actually in the knee joint. This will be the thigh bone and this will be the leg bone. There is a kneecap in front. There is something, a cushion or a shock absorber called cartilage. As you grow older, like how I have become bald, the cartilage also will get worn away. So when the bones move, it will develop friction and people will develop joint pain. That is called osteoarthritis of the knee. It is a degenerative condition. It is not an inflammatory condition. It occurs in people who have injured the knee earlier. It occurs in people who are very, very obese. All osteoarthritic patients should diet and come to the normal body weight. It makes they have difficulty in climbing up stairs, descending downstairs, and please avoid squatting. What have you gained in this world by squatting on the floor? Nothing, to be very frank. So if you cannot squat, nothing wrong. If I do not squat, if I'm destined to live for 100 years, I will live for 100 years. Osteoarthritic patients, because of wear and tear of the knee joint, should never squat on the floor. They should never use an Indian toilet. They should always use an English toilet. That's very, very important. Climbing stairs, you can do it, but do it only with restriction. You can still climb stairs, but do it with great restriction. You have to meet a physiotherapist who will teach you all strengthening exercises for the knee, and that's very important. Does arthritis occurs because of genes? I did tell you that there is some that some people in some, like rheumatoid arthritis, less than 1%, in a disease called systemic lupus, less than 1%. In gout also it's hereditary. The other diseases are not hereditary at all, but there is no vaccine. Hello sir, thank you for a great session. Is there any surgery, physio treatment due to rheumatoid arthritis? My mother has RA since 25 years, the deformation. Let me tell you, lady, I don't want to mention names. Now, when people develop deformities, surgery, corrective surgery is available in India. There are very, very efficient plastic surgeons who can correct the deformity, and even the smaller joints, like the smaller joints of the fingers, toes can be replaced. So don't get worried. And physiotherapy is very, very important. Now what we have physiotherapists, we have occupational therapists. They'll give you dynamic splints, how to improve your deformity, exercises to prevent deformities. What I'm telling you, the day one anybody has rheumatoid arthritis, from that day you should do exercises for the smaller joints of the hands and feet and the other joints, because it can prevent deformity. If deformity has occurred, you can consult a hand surgeon and he will definitely put you on to a physiotherapist who is capable. In my practice, I always take the help of the orthopedic surgeon and a hand surgeon. That's very, very important. Hi, will arthritis in knee lead to knee damage and eventually go to a stage of knee replacement? Now, it all depends upon the age, ma. If you suppose you're 24 and the commonest cause of knee pain is wrong footwear. Nowadays, I see people wearing high heels, no? The toe is actually in the ground floor and the heel is on the 5th floor. Such a big heels they wear. I do not know why. I know I do accept that the women want to look down at men, but it doesn't mean you should wear high heel slippers like this. You buy platforms, no? They give you equal distribution. You can be taller than me, no problem. I am only 5 feet, 161 centimeters. I myself am not wearing a high heel. Don't wear wrong footwear. That's very, very important. Number 2, your joints can be mobile a little, hypermobility because such people can develop pain. And suddenly you start doing exercise. No, overnight Gyan will come and some God will come in the night and tell you, come on man, do exercise. Come on lady, start doing exercise tomorrow. Immediately you'll go to the sports shop, buy all the things and go running for about half an hour first day. Second day you'll have cramps, and the third day all the clothing will be inside the cupboard. Like how our clothing was there during COVID times and we had no necessity to wear all this caustic clothes and go out. Graded exercise is very, very important. The second important fact, once there is knee pain, what is required is you have to modify your lifestyle, do a lot of knee exercises, reduce your body weight, take care of your knees, be very nice to them, be gentle to them, be good to them. Don't over exercise, but you can do walking, running, jogging, etc. But if you have severe knee pain, please do not do this treadmill and all. That's very, very important. I'm a lady age of 24 and if I sit for 5 minutes or more, I'm getting hip pain. This you may have to consult a rheumatologist or an orthopedic surgeon man to find out if you have any hip problem. Then there is a person with lupus on anti-immune tablets that will have an impact on arthritis. Some medications which you give for SLE, systemic lupus, is a condition where people present with fever, they develop rash on the cheeks, what we call a butterfly rash. They'll have fall of hair, they'll have swelling in the joint. Unfortunately, this disease affects the heart, it can affect the lungs, majority will also affect the kidney. So these people have to take lifelong treatment under rheumatologist supervision. We give them steroids and we also give them some immunosuppressive drugs, which are quite important in their management. But none of the drugs can cause arthritis, but SLE per se, systemic lupus per se, can cause deforming arthritis, for which we have very good medications and physiotherapy available. Systemic lupus patients can get married, can have children also. That's very, very important. I forgot to tell you, no arthritis is infectious. Just because I got arthritis doesn't mean I infect the whole household with arthritis. I'm not coronavirus, you know. People avoid patients, arthritic patients like the plague. If they see somebody walking with a little deformity, they run to the 8th road. It's not infectious. It's not infectious like TB or something, or COVID. Why? When you're walking around without masks and not frightened about COVID, why should you run away from an arthritic fellow who cannot infect you at all? I'm aged about 69 years and I have low back pain. I do not know swimming. Is it advisable to learn swimming now, as many people are advising? Whenever I get slight back pain, I used to have hot water packs. And I get this is once in a fortnight. And so I tell you one thing, sir, you have probably, I tell you, both of us are the same age, right? You may probably be having very weak back muscles. First, you'll have to correct your posture at home, how you are sitting down, how you are lying down, and how you sit in the easy chair, all those things. You'll have to consult mainly a physiotherapist for that. How to sit, how not to sit, or what you call posture maintenance, And nowadays, people at 69 still abroad, 80, 85 years also they learn swimming. Now we have what is called as hydrotherapy. People are asked to walk within the swimming pool and definitely it improves. You can get along with that. Hot pack is safe. Permanent solution, it depends what the problem is, whether there's a disc problem, whether it's compressing the nerve. I think at 69, both of us are only mechanical problems. Otherwise, you are fine. Nothing to get worried. Do your exercises, maintain your body weight and maintain a proper posture. What we call ergonomics, about which I should be talking next week. I'm a age of lady 25 years and I've sit for more than 20. Is it vitamin D deficiency or lack of them? Nothing, ma. First, you have pain, you have to consult the doctor. Invariably, from this is a very commonly seen. This is mainly due to lack of exercise. Now, one important thing, most of us have vitamin D deficiency. Vitamin D deficiency. Why does it occur? So much of sunlight in India. India is a tropical climate. So much of sunlight available. The best source of vitamin D is sunlight. Where do we see the sun? We see it only in the film. Last time I saw the film was in the movie The Lion King, you know. The sun rose and the Lion King, Mustafa came along with Simba and everybody clapped. That's the last time I saw the sun. I'm always wedded to inside the door. Now COVID also. Then when I go to the hospital, I'm inside the door. No exposure to sunlight at all. All of us should expose ourselves to sunlight. Not fully clothed. You wear clothes to a decent extent and you should stand in the sunlight. They say 11:30, 12:30, 11:30, 12:30 you go and stand in India, in Madras you'll become mad. Already we are all insane. I'm telling you about 7:30 to 7:45 to or 7:50, 20 minutes. Get yourself exposed to the sun. It's a very good source of vitamin D. But sometimes the joint pain can also be due to vitamin D deficiency. Get a vitamin blood D3 done in the fasting state. Now vitamin tablets are available. Good source of vitamin D is dairy products, milk, yogurt, cheese, etc. Very important is the sunlight. Another important problem is we wear sunscreeners and go and stand in the sunlight. This is crazy, no? You want to get wet in the rain, but you're using an umbrella and a raincoat. How can it happen like that? So I see people, oh, I go and stand in the sunlight now from 7:30 to 7:50. But doc, before I getting in, I just put all sunscreeners in my face and neck. Then I said, you can put the sunscreener and sit inside the room. So don't use a sunscreener before getting exposed. Current cracking joints cause weakness. It is absolutely a myth. Cracking joints is nothing but due to hypermobility of the joint, is to what you call bursting of the small air bubbles within the joint. It is a normal phenomenon, but don't keep on doing like that. Now, some people very egoistically very proud to see my knuckles make noise. What have you achieved by showing somebody that your knuckles make noise? This is done only in the Kamala 3-ring circus. Don't do it. It will not cause arthritis. Does regular yoga practice help to get rid of knee pain? Fantastic. I forgot to tell you very important. Yoga is a wonderful exercise. Born in India. A born Indian, ill-treated in India. We have to ape the West, learn from the West that yoga is very useful. Now everybody is getting to yoga. You need somebody from the West to tell you have to do yoga. Yoga is best. I request every Indian to learn yoga and do it perfectly. People in the elderly age group, people with low back pain or neck pain, etc. should consult a doctor before getting it. Yoga is an excellent exercise. I had gout and took apple cider vinegar as per Google's advice. It is really good for gout. This question you should ask only Google. Because Google only advised you. It is not do all this. Sir, I'm telling you, sir, please don't follow the advice in the internet. Sir, we are all qualified, sir. We studied with great difficulty for 10 years and still we don't know so much, sir. Google came only about a few years ago, sir. I appreciate Google. I use Google a lot. Great technology in the world. But Google is not wrong. People who post in Google are wrong. First of all, it's a wonderful session and it is really useful. Thanks for that talk. I have two problems. One is pinching pain in the right side low back. Now it's radiating legs. Second one, I have a crackling sound in the knee joint, getting more pain. Also, I was sleeping, feeling mild burning sensation at all. Do I have to consult nerve doctor or the doctor? Can I do exercise, having, especially walking, jogging, all? You need not consult orthopedic doctor or any other doctor. Just consult an ordinary general physician. You don't have any major problem. Who will address your problem to a physiotherapist who will teach you exercise. There is nothing to get worried at all. You can jog, walk, everything. Nothing to get worried at all. Nothing to do.